Hi everyone. Happy Thursday. It's Thursday. Let's just wait a few minutes. I'm gonna start the live at 10:04, so I'll just give everyone a few minutes to get here and then we can begin. Thanks for joining, Gus. Let's see. Has everyone had a good week so far? The week's almost over, so that's always exciting. Hello, Jeremy. Thanks for joining us today. We're going to be starting in just a minute. I'm just going to wait a few minutes for anyone else that's going to join us today. And we can begin. Okay. All right, we can go ahead and get started. My name is Ibukun, and I use she, her pronouns. And today we're going to be talking about social determinants of health. And before I get started, I do just want to say that during the past few months, the Whitman-Walker Health's Community Health Department has expanded our outreach efforts to the social media platform. So we've been covering various topics ranging from HIV, STI, sexual health practices to access to care. We've been talking about the COVID-19 pandemic. And like I said, today we're actually going to be talking about social determinants of health. And I'm really excited to discuss this with us because I believe the social determinants of health really really help paint the picture of why there's certain issues in healthcare and just how there's just so many factors that influence an individual's ability to get health or to be at their optimal health level. So to begin, I'm just going to define what a social determinant of health is. So social determinant of health are the conditions in which conditions in the places where people live, work, learn, play, that affect a wide range of health and equity, of health and quality of life risk and outcomes. So the CDC has actually categorized the social determinants of health into 5 different categories or domains, which are economic stability, education, health and healthcare, neighborhood and built environment, and then finally social and community context. So basically, in order to create effective programs that can be implemented to the community that will end up being beneficial to the community, you need to ensure that these programs are actually targeting every tenet of the social determinants of health. So today I just really want us to talk a little bit more about each different category of social determinants of health and just how they affect the community that Whitman-Walker serves and ways that we can, just positively improve on these. So first, I want us to talk about economic stability. So in the U.S. currently, 1 in 10 people live in poverty, and 22% of self-identified individuals that are in the LGBTQ community actually live in poverty as compared to the 18% of cisgender straight people living in poverty. So due to these rates of poverty, oftentimes these individuals can't afford basic things such as healthy foods, health care, housing, and these 3 things that I've listed are the basic tenets of human life and being able to just exist in humanity. So it's essential that when we create programs, they are created to help individuals gain greater economic stability, which will ultimately improve their health. So next I want to talk about education. So 17% of self-identified members of the LGBTQ community have earned a bachelor's degree as compared to the 18% of cisgender straight people that have bachelor's degrees. So it's important that with educational institutions, it's important that these institutions actually have spaces that are created for the LGBTQ community where they can feel comfortable, welcomed, and ultimately strive to gain education, because that will ultimately improve on their health care or on their health and wellness. So next I want to talk about healthcare access and quality. So it is not new information that the LGBTQ community has a harder time receiving healthcare services that they need. There's multiple reasons for why there's problems with receiving healthcare. One of them is, oftentimes the LGBTQ community does not feel comfortable disclosing certain issues they have with their physicians or their providers because of fear of judgment, discrimination, or just being ignored because they don't think their problems are valid. In fact, 1 in 10 people living in the U.S. Don't have health insurance. So if you don't have health insurance, you're less likely to have a primary care physician that you can reach out to when you have any healthcare problems. And you're also less likely to be able to just afford healthcare services and medications and emergencies that occur with healthcare. And that can include, getting medications such as PrEP, PEP, birth control, abortion services. I mean, if you have no access to healthcare or the education behind accessing healthcare, you're often disadvantaged to receiving the healthcare services that they may need. So it's important that there are resources available for people who do not have access to ensure that they're able to receive the adequate healthcare they need. And the next social determinant of health I want us to talk about is neighborhood and built environment. And basically, the built environment just is taking note of the area in which a person is living. So you can think about when you're trying to look at your built environment, you're taking in factors such as, are there high rates of violence? Is the air and water unsafe to drink and breathe? Is there pollution occurring in the area? There's also, are there higher police monitoring or presence in the area? And when you look at statistics and data, oftentimes sexual minorities as well as racial minorities, or people who identify with both as both a sexual minority and a racial minority, they actually tend to live in spaces where these risks are at a higher rate. And ultimately, they are negatively impacting their health. So it's really important that there are interventions and policy changes occurring at both the local and state level and the federal level to help reduce these health and safety risks in order to promote health. And finally, I just want us to talk about the final social determinant of health, which is the social and community context. We know that relationships and interactions with one's family, whether chosen or biological, is very essential to keeping up with one's health. And we've seen that with the pandemic, where we had to, isolate ourselves from the people we cared about. We had to isolate ourselves from our friends, our coworkers, our community members. Oftentimes, the LGBTQ community can feel very lonely and lack these close relationships with people. And, this is when these can cause higher rates of mental health issues, higher rates of loneliness, where you feel like you can't share your struggles with other people, so that you feel like you're carrying the burden by yourself. And ultimately, it's important that we're able to foster these relationships with other people in the queer community as well as with the allies. So when organizations are creating programs, this should also be at the forefront of the programs they're creating. So those are the 5 social determinants of health. And I really hope you've learned something about these, and you've kind of examined your own health and seeing where are you lacking. Is it that your neighborhood and built environment is not conducive to your health, or is it that you are, lacking the social and community relationship that you need to be at optimal health? So we just really want to encourage everyone to just take a second and assess the social determinants of health as they apply to you, because these are all on an individual basis. But I really hope you learned something from that. And before I go, I just want to talk about the COVID-19 pandemic and the vaccines. So if you haven't already been vaccinated, if you have been vaccinated, we just want to say thank you for doing that. Congrats for taking a step to protecting yourself, your community, your family from the illness. And we do want to encourage you to continue wearing your mask and social distancing and just practicing the CDC guidelines. If you haven't been vaccinated and you are looking for an appointment, we urge you to come to Whitman-Walker. We actually are offering the vaccine for anyone that is ages 12 and up. And you can make an appointment by calling 202-207-2480. And if for some reason you're having problems getting in contact with us, you can, and you live in the DC area, you can call 1-855-363-0333. If you live in Maryland, you can call 855-634-6829. And if you're in Virginia, you can call 877-829-4682. And if you haven't been vaccinated and you are not looking for an appointment, we highly recommend still following the CDC guidelines. So quarantining, social distancing, wearing your mask, washing your hands, limiting interactions with other people because you just don't know who's vaccinated and who's not. And just continue practicing those safety guidelines just to ensure that we're all doing our part. And finally, I just want to remind us again about the Whitman-Walker Walk to End HIV, which is occurring October 23rd, which is actually this Saturday. It's a virtual walk, so you do not have to be in DC. You can do it from anywhere. Just go by yourself or create a team, whatever really floats your boat, you can do. But we really want to urge you to participate with this walk because it's our 35th anniversary, and that's very exciting. And finally, we just want to remind you to follow us on Instagram, TikTok, Facebook, Twitter, YouTube at Whitman-Walker. And please follow our website at www.whitman-walker.org. And you can also call us at 202-797-4439. If you have any questions, please leave them in the comment section after this is posted. And I will see you guys next time. Bye.